Hello everyone and welcome to the latest interview in the Patient Perspective series. Today we are going to be joined by Kay Parkinson, who is going to be sharing her story about Alzheimer's syndrome and her involvement in the rare disease community as well. So Kay, if you could just introduce yourself and tell everyone a little bit about what you do as well.
Okay, so I'm Kay Parkinson. I was the mother of two children who had the ultra-rare disease Alström syndrome. I founded that charity and Alström Europe. We were very successful during my time as CEO there in gaining national specialised commissioning for the service. And I was CEO for 15 years there. And then I was asked to join Cambridge Rare Disease Network and set them up as a charity. And really, whilst I was there, I saw many of the rare diseases lack the services that we developed for Alström syndrome. And it really made me realise how inequitable and really sad to see there was no professional overarching management really in this country of rare diseases. And really it was through my time there that I started to work on the idea that there should be a rare disease nurse network, which would be similar to what Macmillan operates for cancer patients, because, you know, equally rare disease patients are often as sick, if not sicker, with life-limiting diseases as cancer patients. Which is where I am now, although I'm actually retired. I am the founder of Rare Disease Nurse Network, and I still work as a company secretary. I've been very busy this last week writing a grant for them.
Yeah, I mean, if we just go back to kind of where your rare disease kind of journey began, both your children, Matthew and Charlotte, were diagnosed with Alström syndrome. For those who don't know, would you be able to kind of give us a little bit of a background about what that condition is and kind of the symptoms it involved in that as well?
Yes, Alström syndrome is a multi-organ disorder. Really the first signs with my children were their eyesight. They could not tolerate bright lights. You know, they'd really have to screw their eyes up, even on a day like today, which is very, very dull. And so really their first encounters with the medical profession was with eye specialists. And for very many years, it was thought just to be an eye condition. But they started developing other symptoms. They gained weight rapidly. Their hearing, particularly my daughter's hearing at a very early age, was very low. But it would seem at that time, every time we saw a new eye specialist, we got a new diagnosis. So they thought it was ocular albinism, because Matthew had really blonde hair, but Charlotte didn't. They thought about 3 more other conditions, and it wasn't actually till my son Matthew collapsed when he was 16 years old with heart failure that it was re-looked at. And the consultant at the time then thought they had a condition called Leber's amaurosis. Now, quite fortuitously, they hadn't been diagnosed long with Leber's when I got a letter through saying Great Ormond Street Hospital, there was a consultant there researching Leber's, and would I take the children up there? So we did, and we hadn't been in the room long before the consultant said, well, it's not Leber's, but I do know what it is. And she then took me down to her office, and she had a chart on the wall of 22 patients that she had been researching. And she said, I think this is what your children have got. Just look at this chart and see if there's any resonance. And there was, you know, it was really like seeing my children's condition lit up. And she said, well, actually, it's Alström syndrome, and your children will be diabetic, and you will need to get them to a diabetic specialist. And in fact, when we did, I think, you know, Charlotte had been diabetic for very many years. Her school used to tell me she was a greedy little girl who used to drink all the water on the dining room table. The school GP had told me off because they were gaining weight rapidly, although, you know, my husband and I worked and we all had the same diet. And she also said, you know, there are many other conditions of which, you know, the heart failure, dilated cardiomyopathy, as it was thought to be, is part of that condition. So really for us, the diagnosis wasn't so much of a terror because we'd actually lived the terrors. You know, my children had been whipped, blue lighted to hospital, collapsing, you know, with heart failure and later kidney failure. So much of their treatment was accident and emergency care because nobody had known what they had. And in fact, when Great Ormond Street diagnosed my children, when I came back home to Devon, the doctors didn't know anything about it here. And in fact, it was a work colleague of mine, her husband was a psychologist, and I told her the condition and he Googled it. I didn't have computers then, and I think there was only hospital people had, and he was very interested because it was a new diagnosis. So he Googled it and he found out that there was Alström Syndrome International, and it was based at Bar Harbor at Jackson Laboratory, and they were actually researching this condition. So, you know, we did feel we had a bit of hope then.
Yeah. I mean, they both were diagnosed in their late teens. What impact did this late diagnosis kind of have on them and also you as a family as a whole?
Well, the late diagnosis is devastating because their heart condition had gone untreated and the diabetes had gone untreated. So treatable conditions had been left to their worst possible state. So for both Matthew and Charlotte, it meant their only hope was a heart transplant. And in Charlotte's case, she needed heart kidney transplant. And because of, you know, huge waiting lists, neither got them in time. So Matthew lived a week after a heart transplant and Charlotte actually didn't survive the surgery. So to be diagnosed so late, one, it was a huge cost to the NHS because both needed transplant surgery, and a huge personal cost because we lost both children.
Yeah. And what kind of made you then want to go and set up Alström Syndrome UK, and what was that kind of journey like for you as well?
Well, I was just actually qualifying as a lawyer as a mature student, and instead of going off into a solicitor's office, I decided I'd start a charity for the children. And I was lucky the consultant who diagnosed my children at Great Ormond Street kindly wrote to the other families that she knew and asked them if they wanted to join a support group. And really, we ran it quite ad hoc at the time as a local hotel where we met, and we got the doctors who worked with my children to come and meet more children, so they were gaining in experience. And ultimately, the doctors then moved the clinics that, you know, they were looking at the children to the hospital. And then I found out that there was this highly specialized commissioning service, and I was advised that we could apply for that. So we did, together with the doctors we were working with. And the commissioning service agreed to set up a national specialized commissioning service, was then at Torbay for adults and at the Birmingham Children's Hospital for children. But they didn't want to fund the charity. And of course, you know, having been a lawyer, I knew they couldn't take my 15 years work and my database and just use it without, you know, involving us as a charity. And I had a big meeting then with the Department of Health, who were very concerned that I might take them to court, which I actually was going to take them for a judicial review of their decision making. And so they actually funded the charity as an equal partner in the national commissioning service. And I believe it was the first charity to be included in a tripartite arrangement. But really that indicates to you, the level of professionalism and expertise you need to get that service. Because had I not been trained as a lawyer, I would not have known how to go about it or what to do. So that's probably why most rare diseases don't have a national specialised commissioning service.
Yeah. And what kind of, other than that, kind of what other things have you learned? Like, what did you learn from your time as kind of head of Alstom UK? What are the other kind of lessons that you learned during that time?
Well, I learned, rare disease is very insular. You are looking at your own rare disease, really. You're not looking at the wider picture. There's a huge lack of research because, you don't have enough patients. And it's very difficult to find people who are interested. You end up with a few doctors. I mean, we were lucky that the national specialised commissioning meant that, at least the hospitals we work with were developing a specialism. So it wasn't really till I worked at Cambridge Rare Disease Network as their CEO that it really hit me just how unfair the system was for patients with rare diseases. You've got some of the sickest people in our society really left to support groups, and that's then dependent on who's running that support group, how educated they are, and their knowledge of systems to get their particular support group recognised. And that seems crazy that the sickest people are left to parents in the main who often run these support groups.
Could you just kind of expand more on your time at Cambridge Rare Disease Network and how you got involved there as well?
So really, I was asked to join Cambridge Rare Disease Network because of the work we'd done for Alstom. I'd actually done a talk about how my husband had set up Alstom Syndrome UK. So I was then approached to see if I would set up the Cambridge Rare Disease Network, which was a very exciting challenge because, hopefully you're getting and reaching more rare diseases and, can create networks of professionals and industry who have the potential to actually develop research projects and provide services. But really more and more what struck me, it's really the fact that, we're all gonna need support groups all of the time. Their work is invaluable. But what rare diseases desperately need is a professional, overarching service that is continuous and funded, part of the NHS, because the support group help is sporadic and depends on whether it can get funding, and it depends very much on who's running it. So I think it's desperately unfair that there's no overarching professional service for rare diseases. So I was actually retiring. I told Cambridge I'd do 3 years for them before I retired, which is what I did. And really, it's since I'd retired that I've been working on the Rare Disease Network in a voluntary capacity. But, I'm very hopeful that we've just put in an application for charitable status, that we are successful in actually infiltrating the NHS and gaining a professional nurse service that is available to all people with rare diseases, not just whether or not you've got a support group or how good that support group is.
Yeah. Would you be able to just kind of go over some of the main aims of the Rare Disease Nurse Network and kind of what the plans are as well? Obviously, apart from infiltrating the NHS.
Yes, absolutely. We just teamed up with Cognizant, who have developed Health in Note. So really, a nurse can have the information about any rare disease at her fingertips, not only for herself, but that information can be given to the patient. So straight away, if I go back to my own personal circumstances, if I and the physicians working with my children had had that kind of information available to them, it would have meant their condition would have been better managed. Now, most rare diseases still are untreatable, but they are manageable. And by being properly managed, that can improve quality of care, improves quality of life, and can often prevent, these devastating major surgeries like transplants, amputations, having to take place. So I think the fact we are working straight away with the Rare Disease Nurse Network with technology will mean that, once we are national, we have a service that everyone can access immediately.
Yeah. I mean, since your children's kind of diagnosis, how do you feel like things have changed since then in terms of like treatment and management of this particular condition?
Well, quite clearly for Alström syndrome, they've changed considerably for having no information and nobody knowing about it. There's been dedicated clinics now since 2008. So, the adults are dealt with at Birmingham, Queen Elizabeth Hospital, Birmingham now, and the children still at the Children's Hospital. So they've developed expertise and knowledge about it. But, when you have a CEO role that deals with every rare condition, you just realize how inequitable that is. And why is that not available for everybody? Just because one mother who trained as a lawyer knew how to get through the system doesn't mean that it shouldn't be there for everybody. And it is just inequitable.
Yeah.
So it's grossly unfair that one condition has got, highly specialised commissioning. You've got hospitals who deal with those patients on a regular basis and see them, and you can have another rare condition still back where we were trailing to doctor who never talk to each other, dealing with every individual component part of the disease, not holistically.
Yeah. And how do you think we could potentially kind of reach equity in this area?
You won't reach equity until you have an NHS in-house professional service. And in fact, if you look at the national framework for rare diseases that is out, it pinpoints the lack of coordinated care within rare diseases, and that is appalling. You have parents dealing with the sickest children in our society, having a system that itself recognises lack of coordinated care is a problem. And, that has been the same for the 40 years that I've been working in rare diseases. It's not a joined up service. It's not recognised professionally, dreadful.
Yeah. And what are your kind of hopes for the future?
Well, our hope is that the Rare Disease Nurse Network is commissioned one day by the National Commissioning Team, and that every person who's diagnosed with a rare disease, or every parent whose child is diagnosed with a rare disease, has access to information and coordinated care, and therefore they're not going to have to endure lack of treatments or unnecessary treatments because things haven't been treated properly.
Yeah. Thank you so much, Kay, for sharing your story, and I'm excited to see how the Rare Disease Nurse Network continues as well. So thank you so much.
Thank you, Shan.
Hello everyone, if you enjoyed this video, then make sure you check out some of our other videos in our series by subscribing below or going to our website frontlinegenomics.com. I hope you enjoy.